for the anterior rib points, you'll notice from your manual that it lists an anterior rib 1. That was taught in the very first strain counter strain 1 class. Since then, at strain counter strain 3, they've taught us a more advanced technique that's so effective, I don't even bother with that anterior rib 1 anymore. It's still safe for you to use, but I won't be teaching that today. We'll start first with the anterior rib 2. What you'll do is just take a look at the individual's clavicle. You're going to go mid-clavicle, and immediately down from that mid-clavicle is the anterior rib 2 point. I will then, one finger at a time, press back onto the edge of that second rib. We'll do one side, and then we'll do the other. You're looking again for very full, thick tissue or any tenderness response from the patient. We do ribs 3 through 6. You need to go into the axillary line to palpate those. It's quite challenging. You've got to reach up quite far. We'll take a look on the skeleton here. You'll see how far up into the axilla you've got to reach in order to touch the bottom part of that third rib. And that's what we're doing for the anterior ribs. You're just touching onto that inferior aspect and pushing third, fourth, fifth, and sixth. Put your hands into their axilla. You'll get them to bring their arms out. You reach your hands straight up into the axilla. You then have to make sure that they relax their arms, because if they hold them out, their muscles will be too tight. You're then going to find that bottom part of the rib, and she is quite tender on that third one right there. And you'll do the same thing, first one side and then the other. She's definitely more tender on the right side. I move to the next rib for the fourth, pushing on that inferior aspect. Then the fifth, and then the sixth. So sixth a little bit on the left side. Okay. We're now going to raise the arm up out of the way. This is not how you would normally palpate. We're doing this just to make it easier for you to see. But when I reach my hand up this way, I'm getting along the ribs, and I'm feeling for the hard part of the bony prominence, and I'm going to push on that inferior aspect like that. There's the third, there's the fourth, there's the fifth, and sixth. Now we're going to show treatment for the anterior ribs. The anterior rib 2 is very different from the others, so I'll show that first. Your patient is lying supine. For palpation, that was at that mid-clavicular line, just inferiorly to the clavicle, and I'm pressing straight back onto that rib. It's very thick and full and more tender on this side. To do treatment, you cradle the individual's head, get him to take a nice deep breath to relax, and then you're going to aim their chin toward that tender point. So I reach that head up, passively taking it until I can feel that rib relax and the muscles around it relax. Again, monitoring but not pressing, staying for 90 seconds. Once that's complete, we slowly bring the head back. And then we re-palpate the point. Now, to treat the other ribs, 3 through 6, they were palpated in the axillary line. To treat those, we need to have the patient sit up. This is where I had reached up into that axillary line, and we were palpating that rib on the inferior surface. So if we found a tender rib right there, we'll get him to relax his arms. I'm going to put a pillow over my knee. The opposite arm will go onto that pillow. He needs to move his stool so it's off to his right side just a little bit. When he puts his feet on there, that helps him to side bend better. So when I pull him this way, he will side bend toward that tender point like the rib is going further down. For this one, I like to place this hand on the shoulder so I can gently guide him into that side bend position. And then to fine tune, you're just rotating the individual back just a little bit. I just keep going until I feel the tissue soften underneath my palpating finger, and then the patient reports he no longer has any pain. There's still just a little bit there, isn't there? Mm-hmm. Nice deep breath. He needs to go just a little bit. There we go. Now we've got it. Is that better? Mm-hmm. Okay. That's what fine tuning is all about. Now we would maintain that position for the 90 seconds. This is the same treatment whether I'm treating rib 3, 4, 5, or 6. The difference would be the fine tuning with my getting relaxation under that palpating finger. Now, to reverse this, the patient's going to remove his feet from the stool. I'll hold him steady. And I slowly bring him back up, dropping that arm, and then repalpate that tender point. All right, to palpate the posterior ribs, you'll need to get the scapula out of the way. You do this by just gently taking the person's arm and bringing it across the front of their chest. I like to reach around and hold on to that arm. That way they'll relax their muscles better. Then you're going to go to the top of rib 2 onto that superior surface, and you're going to push down. Then you go to 3, pushing down. 4, I'm going to switch to my thumb, pushing down. And then she's got one right there, kind of thick and full and tender as I push down. I can feel the rib more prominent underneath the thumb and also tender there. And she'll respond quite a bit to that one. So going to the superior aspect of the rib, pushing straight down. Once you're done with this side, you would just gently bring the arm down, and then we'll repeat the process by taking this arm across. Again, reaching up to the top of that rib, pushing straight down on 2, 3, 4, oh, she's got one right there, 5, oh, even more so, and 6. Okay? All right, next we're going to show treatment for posterior ribs. You're going to notice something looks very, very similar. We treated an anterior rib on the patient's side over here. If I had him with this arm across, and I noted that he had a posterior rib tender on this side, the treatment will look almost exactly the same. So if I found a positive posterior rib here, I then would put that same arm over my leg. He would also take that stool to his right a little bit. I would have him take a nice breath. As he breathes out, I'm going to side bend him, and then just like with that anterior rib here, pull it back a little bit, but I'm palpating the rib, posterior rib on this side while I'm doing it. So as you can see, this would have been an anterior rib treatment for this side. This right now I'm doing is a posterior rib on this side. So side bend, opposite side, slight rotation back, palpating the rib right here. Again, palpation without significant pressure, monitoring that point. Maintain that position for 90 seconds. I'm going to hold him steady as he takes his feet off the stool. Slowly return back to start position. Bring that arm across and repalpate the tender.